Colorado's Best, Denver's leading program about making your life even better, with Joanna Canals and Paula Haddock.
Thanks for watching Colorado's Best. I'm Joanna Canals.
And I'm Paula Haddock.
Well, did you know that 10.5% of people in the U.S. have diabetes? Amazing. That's according to the Centers for Disease Control.
So if you have diabetes and have diabetic nerve pain, today's guest has some really valuable information for you. Dr. Dan Wallis, D.C., he's the founder of Elevate Neuropathy in Fort Collins. He's been on with us before, talked about nerve pain, neuropathy. You're back with us today. Welcome back to Colorado's Best. And, you know, let's talk about really what peripheral neuropathy is specifically.
Yeah, well, thanks so much for having me back, guys. We had a lot of fun last time. Glad to be here. So peripheral neuropathy in general is where we start to lose circulation, vascularity, typically to the extremities in the legs and feet or in the hands. And what that does, it starts to degenerate those nerves, and so we get severe nerve damage as well. It can create pain, numbness, tingling, balance issues, a whole host of issues for our patients.
So we mentioned diabetes. What is diabetic nerve pain, and is it the same condition as neuropathy?
Yeah, so today we'll focus a little bit on that specific diabetic nerve pain or neuropathy. And yes, it is neuropathy caused typically by type 2 diabetes. Now what happens is when we have high concentrations of blood sugar and it's chronic and it's there a long time, it creates a big problem in the body in general, but it can also lead to damage in the blood vessels and in the vasculature, leading to damage and problems within those nerves as well. That's why type 2 diabetes typically is associated with neuropathy.
So is it possible to reverse this diabetic nerve pain?
Well, the answer is unequivocally yes, for the right candidate. And so, as with all patients, we always need to know what's their situation, what's the severity of the problem. I like to try to see patients before there's an 85% sensory loss so that we can make a big difference. We always need to see if somebody's the right candidate, but I am happy to say that there are ways to reverse it and to treat it, because most patients have never heard that before.
You have a personal story with all of this. You know, why did you get into this?
Yeah, it's a great question. So my grandfather, he was a Korean War vet, and I just remember him being just a bear of a man, you know, Kansas farmer, woodworker, just total stud. And, you know, in the 60s, 70s, 80s, didn't take care of his health real well and developed type 2 diabetes. And it is a lifestyle disease, and it led to peripheral neuropathy. And same things that we were just talking about, but it took him down quickly. And to the point where, you know, he was in the shop and all these things that I saw, to a walker, to a wheelchair. Frankly, he probably needed amputation. I really believe that's one of the reasons it ruined his quality of life. And so watching that, you know, as we get into treatments here, you know, and seeing him just take gabapentin and more drugs and more injections, all these things, it didn't do anything for him. And so it really kind of piqued my interest of what can we do to actually help this population.
Yeah, not only did it pique your interest, I mean, it inspired you to come up, you know, to help with this treatment. Tell us more about the treatment.
Yeah, so the treatment modalities are robust, and we use advanced technology to really use neurological stimulation devices to re-educate the nerves. We use light therapies and laser therapies in order to bring blood flow and restore capillaries and vascularity, because those nerves need blood and they need nutrients. We have robust nutrition protocols to help with nitric oxide production. And for a lot of these people, we need to help them learn to eat better as well to reduce that blood sugar, that chronic high blood sugar. We need to help reduce that as well. And the crux of all of this is that it can all be done from the comfort of our patient's home. So we love that opportunity there.
That is incredible. The telehealth, they can communicate with you beautifully from their home. And so many people with neuropathy need to do that because a lot of them can't drive themselves.
That's correct.
You know, it's just tough to get around because of it, right?
And they need multiple treatment options where they can be done daily, if not multiple times per day, rather than just once or twice a week in a clinic.
Yeah, and you said you can do this from home.
Correct.
Even the initial consult can be done through telehealth, which is great. You're located in Fort Collins, but everybody can benefit from this. And you have a $49 special that you want to tell people about as well.
Yeah, so that's just a risk-free way to see if they're a candidate for this program. Full consultation, full neuropathy severity evaluation, and recommendations and report of those findings.
Wow, just incredible. I think it offers so many people so much hope.
Yeah.
And once again, I know you're in Fort Collins, so that's wonderful for people in northern Colorado, but the great thing is, if you're right here in Denver or even south, they can give you a call and you can help them
That's
and
correct.
do it from their home. So this is
ma'am.
incredible. So if you or someone you know suffers from neuropathy, call the number here on your screen. Call now for that $49 neuropathy special. And remember, it is for the first 25 callers. So call this number right now. It's 970-316-0785.
Elevate Neuropathy is located at 901 East Harmony Road in Fort Collins. They accept Medicare and most health insurance. For more information, visit ELEVATENeuropathy.com and see how you can take advantage of the telehealth visits and doing this procedure, at home, these treatments. So thank you so much.
Thank you.